My name is Scott Ackerman, and I'm a radiation oncologist here in Jacksonville, Florida. And in my practice of radiation oncology, I see all sorts of cancers, and I see a lot of gynecologic cancers, both uterine cancer and cervical cancer. So uterine cancer is cancer of the womb, of the uterus. We also call it endometrial cancer. And cervical cancer is cancer of that part of the uterus, the lower part of the uterus, which is called the cervix. And most women know about the cervix. That's where they have the pap smear done. It's pap smear is a test where we scrape some cells off the cervix to analyze them and see if they're malignant. But when women come to me with these gynecologic malignancies, the first thing we want to know, the first thing they ask me, is how extensive is the cancer? Has it spread to any other parts of my body? Do I have any other cancers? So what we do is we obtain what's called a PET CT scan prior to treatment. And the PET CT scan is done for two reasons. Number one, it's done to localize the tumor, to see where the cancer is in the body so we can precisely target the radiation. And number two, to ascertain whether there's any other cancer cells anywhere else in the body that may have spread from the gynecologic malignancy, or maybe it's a second cancer that a woman might have elsewhere in her body. So let me tell you how the PET scan is done. It's really not scary. It's not that complicated. For the patient, it's very complicated for us, but not for the patient so much. So you come in, and we inject you with a radioactive sugar. It's table sugar, radioactive glucose, like table sugar. You sit for about an hour, and that sugar goes throughout the body. And the sugar accumulates in areas of the body where there's a high metabolic rate. So it'll accumulate in the brain because you're always thinking, and it also will accumulate in cancers, in tumors that have cancer cells within them. So it's a PET CT scan. So the PET is positron emission tomography. That's where we use this radioactive sugar. And the CT is just short for CAT scan. So you all know what a CAT scan is. That's a scan of the body. We're done with x-rays. It allows us to look at deep into the body and see different slices of the body and to see whether there are structures that are abnormally enlarged or small or whatever. But we superimpose the PET scan onto the CAT scan, and now we could see not just abnormalities in the size of structures in the body, but we could see abnormalities in the amount of metabolism in those structures. We could see if there's heightened metabolic activity, which would mean heightened mitotic activity, which is cancer activity. And so we use this PET scan to very carefully and precisely target our radiation and very carefully and precisely evaluate extent of cancer throughout the body.
For more information on this type of cancer or any other cancers, please call Dr. Scott Ackerman at First Coast Oncology, 904-880-5522, or visit us on the web at www.firstcoastoncology.com.